from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Welcome back. Good Morning Arkansas. In honor of Autism Awareness Month, we have Dr. Laura Wilson of the Sherwood Family Medical Center here to dispel common myths about autism. And joined us today, you may have heard in the background, he's a great kid. He's full of life. His name is Caleb Beeston and his mom, Ashley. Great to have you all here on the show and on the set. How you doing, buddy?
Say hi.
Caleb, how are you today?
Hi.
Hi, how you doing? Where's Spider-Man? Oh, there he is. You love your Spider-Man, don't you? Spider-Man, your coloring book. There are so many myths out there when it comes to autism,
yes.
And I was just looking at one of the lists. Number one, I've always been told, because I've got two kids, it's vaccines.
No, it's not. And I hope most people are learning that these days. There was a fraudulent study back in the 90s that they thought there could be an association between autism and vaccines. That was actually disproven. The doctor that did that had his license revoked.
Really?
But it kind of stirred the pot and got everything going and got everybody worried. They've had many studies now that don't show any link, but it still has created a fear in parents. But we do not think vaccines cause autism.
All right. And myth number two is that all children with autism
are savants, right? So people think of the Rain Man movie and very stereotypical autistic person, that they have these mad skills in certain areas, and certainly occasionally we see that, but not every child has that.
That's in severe cases, right?
Well, not necessarily. It just depends on that individual. But I think a lot of families with children with autism say, well, what's his skill? What can he do? Like he's some party trick kind of kid. And that's just not the truth. Some of them do have some very unique skills, but not all of them have that quality.
All right. And our third myth, children with autism cannot be educated in a mainstream classroom.
Right, and this is a fear I think many new diagnosed children's parents worry about. What does this mean for my child later on? He's going to be in special ed. He's going to be in a contained class. Something's wrong. He can't go to public school. That's actually not true. A lot of these kids are in a mainstream classroom. Some have a full-time aide with them. Some do not. Now, there are some that do need some additional services, but a lot of them are in just the regular classroom like every other kid.
Caleb's 3, right?
He is.
He just seems like a normal 3-year-old.
Oh, yeah.
I mean,
Absolutely.
he's coloring, does great job coloring and having fun, playing with his toys, his action figures.
Right.
Wow. When did you realize that there's something that needs to be checked into?
Right before he turned 2 years old, we know he wasn't speaking, and he wasn't saying the things. He wasn't saying mommy. He wasn't saying daddy. But luckily, we had a doctor that we could talk to and that would listen to us. And when we expressed concern, we got a speech eval or evaluation. And from there, we just started noticing more signs, lack of some social skills, lack of some fine motor skills. And then we ended up getting him diagnosed with autism, which opened up doors for more therapy, which was the most important.
And you said it's the early detection of this that is making the world a difference.
It makes, the earlier you start, the better. Because without your speech or without your ability to function inside your world, you're just getting more and more delayed. So just the earlier, anytime you feel that there might be something wrong or there might be something going on, get an evaluation for speech or for autism and get on it as early as you can.
And that's usually how it starts, is with speech delay. So that's typically, me as a pediatrician and as a parent, the first thing you pick up on. Because the hallmarks of autism are speech delay, which is a very concrete thing you can see. The other is lack of interpersonal or social skills. And so sometimes that takes a little longer in an already kind of rowdy toddler at baseline to see. But the first thing is almost always lack of speech. So just because we have a speech delay doesn't mean you have autism. But to me as a pediatrician, if I'm seeing a speech delay, especially in a boy, it makes me want to look a little closer and go, could this be part of a bigger picture diagnosis?
Right. There's also a myth that this can be cured.
Right. You see all this stuff about special diets or herbal therapies or alternative care, and really none of that is proven to fix things. It's not proven to help, but it's certainly not proven to cure. But what we do know is that therapies have shown great benefit for these kids. And just like Ashley was saying, the earlier we get these started, the better the long-term outcome. We talk about therapies, we're talking about speech, occupational therapy, potentially physical therapy. There's behavioral therapy called ABA therapy, which is kind of teaching them more behavioral or communication skills. In schools, you can get what's called an IEP. That's an individualized education program. These are all tools to help the child, and those definitely help.
I think there's also the myth, some sort of stereotype that they're not going to be functioning members of society when they get older. And I know people who are autistic that are doing wonderful and very successful in their chosen career path.
That's exactly right, and it has no bearing on intelligence either. We can have an average intelligence, a very highly intelligent individual. They can be very functional. Now, there are some that require a lot more care into even adulthood, but the vast majority grow up to be good functional adults, and maybe they're a little quirky, but that makes them more interesting.
It adds more personality.
That's right. That's right.
So what's the, we don't have much time left, but do you think was the most most important thing you learned about autism that you may want to share with parents that just found out that their child may have autism?
The challenge is a lot of people want to say, don't worry about it. He's just shy. He'll get it eventually. Be proactive. Don't fall into that pitfall of, oh, they'll grow out of it. Be proactive and get your evaluations and speak to your doctor and just be honest how you feel and get them the treatment that they need, because his therapist have changed his life.
Yes.
And so the quicker you can get in with the right therapist, the best.
All right. Well, thank you very much for coming on the show.
Thank you.
It was great having you, Caleb.
Thank you,
Caleb, you
Kayla.
got anything to add?
Thank you. What's your favorite action figure? Who is it?
Yes.
Who is this?
Spider-Man.
Yeah. Who doesn't like Spider-Man? Thank you so much.
Thank you very much.